Hello and good morning. Welcome to the Center for Biomedical and Minority Health Research Community Engagement Core, our January seminar, our first seminar of 2022. Today we are going to be talking about self-care and resources for people living with heart disease and their caregivers.
Texas Southern University's Center for Biomedical and Minority Health Research Community Engagement Core is funded by the National Institute of Minority Health and Health Disparity Research Center for Minority Institutions program. The CEC works directly with communities to identify and address health-related concerns and reduce health disparities related to ethnic minorities. We provide health education and partnerships with healthcare systems, federally qualified health centers, community and faith-based organizations. For more information, visit us on social media at CEC Texas Southern U, or give us a call at 713-313-1233, or send us an email at cbmhrcommunity@tsu.edu.
All right, welcome everyone. Thank you for joining. Please remain muted throughout the presentation. There will be a question and answer session at the end. You can also post your questions in the chat box during the presentation. We would like to thank our partnering agency, Prairie View A&M Cooperative Extension Program, the Waller County Extension. We would also like to thank the DAWN Center, that stands for Diabetes Awareness and Wellness Network, with the Houston Health Department, which provides free diabetes self-management education and many other services to Houstonians in order to reduce and prevent chronic disease. Okay. And this is a little video explaining the DAWN Center.
We all want to be healthy, feel good, and function better. Our health is the foundation of all our goals, dreams, and all that we value most. But too often, you don't realize just how important your health is until you lose it and when crisis hits. Then we're willing to do whatever it takes to gain our health back. Here at DAWN, the Diabetes Awareness and Wellness Network, we offer free programming and services to those diagnosed with and at risk for diabetes.
I come here, it's like I'm coming home. Well, they're very supportive, and if I have any concerns, they will help me out with any concerns. And that helps a lot, especially when you live by yourself. So it's been very helpful. Out there, if people need a lot of help, because there are people that have diabetes and they don't even know they have it. And that's why so many people are in a lot of trouble, health trouble. I learned how to eat right, put more attention to my health, and be more active also. Because when I came, I was like almost 300 pounds. So it's been hard, but it's been great because they're very supportive.
At DAWN, members enjoy a full one-stop shop for diabetes and wellness education. We provide lifestyle enhancement to improve disease management and quality of life. Active living, healthy eating, self-management, health connection, health coaching, and community engagement. Enrollment is free, so become a DAWN member today and take control of your future.
Okay. All right. At the conclusion of today's seminar, there will be a survey. You'll click on the link in the chat box and it will allow you to access that link. The first 10 attendees to complete the survey will receive a gift bag from us. So please be on the lookout at the end of today's seminar for that link. All right, so today we have this is also, wanted to talk to you about our next seminar, which is scheduled for February 23rd. And we will have Dr. Ellis Morrow, who is a dietitian and faculty here at Texas Southern University. And we will have Chef Shonah back one more time to give us some tidbits on healthy cooking. All right, without further ado, I would like to introduce our speaker for today, Dr. Lakecia Pitts. She was born and raised on the south side of Houston, Texas. Dr. Pitts studied business management at University of Texas in San Antonio and later attended Texas A&M, where she got her MBA and also completed 4 years of medical school. She completed 3 years of training at the University of North Carolina's Family Medicine Residency Program and did an additional 1 year fellowship at Kaiser Permanente in HIV primary care. Dr. Pitts currently works at Avenue 360 Health and Wellness Clinic, where she provides a variety of services primarily for uninsured and underinsured individuals living with HIV. Outside of medicine, Dr. Pitts is an award-winning artist, best known for her shower singing and her bathroom dancing. Join her for dinner as she jams her vinyl records while cooking, and you're sure to have a great time. It brings her joy to empower and uplift others to realize their full potential. I love that. I am definitely a shower singer, but please don't listen. Like it doesn't sound good. It sounds good to me, but no one else. So yes, that's why it stays confined in the shower. I also sing in my car. Very loudly, but the windows are up, so nobody has to hear it. Well, thank you so much for being here today. I am going to turn it over to you. Everybody, please be sure to hang on till Dr. Pitts is done so that we can have our cooking demonstration as well. So Dr. Pitts, thank you so much. I am going to turn it over to you. Thank you for being here.
Yes, ma'am. Thank you so much for having me. It's as long as it sounds good to you, that's all that matters, okay? That's all that matters. Good morning, everyone. I am super excited to be here with y'all today to talk a little bit about some self-care and resources for those of you who may be living with heart disease or who may be caregivers of loved ones who are living with heart disease. And so let me get my screen together over here. Okay, share screen. All right. And then let's get the actual presentation started. All right, can we see everything okay?
Yes, it's perfect. Thank you.
All right, well, let's get right to it, y'all. Again, I'm excited to be here with y'all today. Dr. Ndefo, thank you for that great introduction. I am a family medicine physician, as she mentioned, and I do specialize in HIV primary care as well with Avenue 360 Health and Wellness Clinic. And I'm super excited today. I created this presentation with a couple of different perspectives in mind. One as a doctor who takes care of people living with heart disease, but also as a granddaughter of a grandmother who has heart disease and a daughter of a mother who cares for my grandmother. And so hopefully the information that's here today, you will find helpful and that it will empower you and give you the information that you need in order to maintain your health and to care for yourselves. Just want to do a little quick word about Avenue 360 Health and Wellness. I'm excited that I'm able to represent my clinic today. I started in August of last year and was really drawn to the fact that our clinic takes pride in providing high quality, caring, and comprehensive service to the individuals that we take care of throughout the city of Houston. But what I really love about Avenue 360 is that we pride ourselves in caring for the whole person and really trying to address the complex needs that occur outside of just medicine in the clinic, but that still have a huge impact on a person's overall health. And part of that means partnering with organizations like the Community Engagement Corps to do presentations like this today to inform the community about ways that they can take greater control over their health. So without belaboring the point, let's get right into it. There are 4 things I really want to go over today. All right. The first one is just to really quickly do some definitions. What is self-care? What is heart disease? What are some risk factors for developing heart disease? What are some symptoms of heart disease? And there are a number of different types of heart disease. We'll focus primarily on 3 today, and we'll get into those in just a second. What are some ways and things that you can do at home to help to manage your conditions? And then briefly discuss the importance of advanced care planning, particularly for those who may have advanced heart disease. So let's get right into it. What is self-care? Self-care can be defined as actions that are taken by us as individuals to improve our overall health. And for those of you who are here with us today who may have heart disease or caregivers of those with heart disease, the key is really, once we've been diagnosed, once there has been a diagnosis of heart disease, how do we maintain health? And my hope is that after today's presentation, you will have the information that you need to really maximize how you care for yourself and your loved ones. What is heart disease? Heart disease refers to several different types of conditions, as you can see here in this really cute little picture. But really, you can think of it as any problem with the structure or the function of the heart. And today I want to just quickly go over the 3 most common that I see, that we see in practice: coronary artery disease, heart attacks, and heart failure. Okay, and we'll get into each of those in just a second. What are risk factors for heart disease? What causes some people to ultimately have issues or have heart problems? And I really like to break this down into two different sections. The things that are outside of our control, like the first 2, age and family history, and then everything else which falls under things which we can control, like smoking or excessive alcohol, drug use, not exercising regularly, eating unhealthy. Those are all unhealthy or bad habits that ultimately causes the following consequences: high blood pressure, high cholesterol, diabetes, and all these things over time increase the risk for heart disease. All right. So let's jump into some symptoms here. Let's talk a little bit about coronary artery disease. Coronary artery disease, this is a really great picture here because you see the heart, which is a muscle that pumps blood to the rest of the body. And you see these little blood vessels that provide oxygen and nutrients for the muscle as it works, right? What happens with coronary artery disease is that over time, cholesterol plaques build up in the blood vessels. So these blood vessels that were once nice and open now become more narrow, okay? And as that process progresses, when there are certain stressors or triggers like exercise, emotional distress, sex, and a number of other different things where the heart is having to work a lot harder, then what can happen is there's decreased blood flow to the heart, which ultimately can damage the heart and cause something called a heart attack, or we call it myocardial infarction or heart attack. Some people may never have any symptoms of coronary artery disease until they have a heart attack, which is why it's really important to make some of those lifestyle changes that we talked about earlier and that we'll talk about in just a bit here to try to decrease the risk of those things happening to you. what happens when we have a heart attack? I'm sure many of you are aware and have seen commercials or read different brochures about what a heart attack may feel like. And the common thing we think of is chest pain. And it can be sometimes very hard to describe, right? It can be a different type of pain, right? It can be a squeezing, a tightness, it can feel like, excuse me, there's a band-like pain or wrapped around the entire chest. Excuse me. If you wear, for women who wear bras, it may feel like my bra feels like it's a little tighter than usual today. Excuse me. And we can also see that it can cause a pressure as if something heavy is sitting on the chest. Excuse me, y'all. Excuse me, I didn't bring my water with me today. It can it can feel as if there's a pressure or something sitting on the chest. And we can also see that that discomfort can be felt in areas that are very close to where the heart lives, which is on the left side of the chest. So we can see that there may be a shoulder discomfort, arm discomfort, neck or jaw discomfort, shoulder blade, or even stomach issues as well. Some people may have a hard time breathing, may feel lightheaded, may break out into a cold sweat. Some can have an upset stomach and feel really nauseous, and other people may feel really, really tired, okay? It just really varies as far as what symptoms a person may experience, okay? Over time, coronary artery disease and heart attacks, as well as other conditions, can weaken the heart muscle, and this causes heart failure. And ultimately, heart failure is where the heart can't pump blood to the rest of the body the way that it should. Right. And here's a really great video that explains some of the signs and symptoms of heart failure.
Dr. Pitts, we can't hear the sound.
You can't? Oh no. Okay. Oh no. Okay, let's do this here. Let's pause it. Is it too low or you can't hear it at all?
I can't hear it at all. I don't know if it's just me now.
Okay, let me see. Give me 1 second here. Okay. Thank you for stopping me and letting me know. Let's see. I'm going to try. Let's try here. You still can't hear? Let me know if you still can't hear anything. I'm just going to play it real quick, okay?
No, unfortunately, we can't hear it.
Oh no, I'm so sad because it's such a great video. It's such a great video. Ultimately, what some of the symptoms of heart failure, I'm so bummed by this because this is
okay.
a really.
I think what we might be able to do is if there's a link, we can share it.
Okay, yeah, let me see.
Yeah, and then people can watch
okay.
it because I like that. I need this for my class.
Let me see how would you like for me to share it right now?
No, you can finish up and then you can send
Okay.
it to us and we'll share it with everyone.
Okay, I got you. So let me kind of briefly go over some of the symptoms of heart failure. If you can imagine, if the heart isn't able to pump blood efficiently to the rest of the body, some of those symptoms that folks can experience is trouble breathing with regular routine activities. My grandmother, I would notice that when she would walk from the couch in the living room to the sink in the kitchen, she would be very winded doing that. And oftentimes when she sat down, it took her a while to catch her breath again. Or I would notice that her legs on both sides were more swollen. And if I went to take my finger and push in her legs, there was a little indentation there that was left that helped me to know, well, maybe things are a little backed up and she needs some help getting her heart failure more optimized. Some people may feel really tired, can have trouble sleeping, right? So oftentimes I like to ask individuals, Are you able to lie flat without any trouble at nighttime? Or are you finding yourself needing to sleep on more pillows at night so that you can breathe better? Or are you needing to sleep in a reclining chair so that you can breathe better? And oftentimes folks can have swelling in the belly as well and can have low appetite or trouble eating because of all of the fluid that the body is holding on to, okay? And hopefully we'll be able to share this video with y'all so that you can check it out, because it's an excellent, with the pictures and them going through the symptoms, it's an excellent resource. But why is this important, y'all? This is important for us to know because heart disease is the leading cause of death for men and women in the United States. 1 in every 4 men and 1 in every 5 women in this country die every year from heart disease. So that's why it's important that you know and you recognize these symptoms and that you seek medical care and follow the advice of your provider, especially if you've already been diagnosed with a heart condition, so that way you can prevent further progression of things, okay? All right. Let's get into some more stuff. How do we manage some of this stuff at home? How do we do that? Medications. Medications is a big one. It's gonna be super important that whatever medications you are being prescribed by your provider, that you take them every day as you are supposed to, as they recommend you to take them, right? And oftentimes that means taking medications to control the blood pressure, the cholesterol, to treat and manage the diabetes. When we are not taking the medications that are used to treat these different things, it can cause us to have symptoms and to feel bad, and can cause a lot of people to be constantly admitted to the hospital for the same symptoms when they're not taking the medications. I think it's important that you keep an updated list of all your current medications, especially if you are seeing multiple different doctors or providers and different specialists, because it's important that when your provider is seeing you, that they don't add another medication that may interact with the medicine that you are taking and that may cause other symptoms. I would recommend that before you add any other medications, any supplements, any over-the-counter medicines, that you talk to your provider. One, because adding some of those over-the-counter medications and supplements can interact with some of your current medications that you may be on, but also, for instance, for those who have really bad heart failure or who have coronary artery disease, taking things like ibuprofen regularly can potentially trigger you and increase your risk of needing to be hospitalized because of a flare-up of your symptoms, okay? And then another thing too is many people don't know that things like Goody powder and BC powder, that those contain medications that are similar to ibuprofen, and those are things that can also, again, can exacerbate or worsen your current medical condition. So definitely talk to your provider and let them know before you take anything over the counter, okay? I just wanted to just really talk just a quick second about this, because I've experienced this personally from my family, as well as with some of the families or caregivers of people who have heart conditions that I've seen in clinic. And oftentimes there may be this frustration where, well, this person isn't motivated, they're being lazy, or they're not doing what they need to do to take care of their health and to take their medications. But oftentimes there can be other things going on that could be contributing to their ability to take their medications. And one of the big ones that we see is depression, right? Depression can affect anybody, young, older, more seasoned, and can really cause someone to not really be motivated to take their medications. And so if you notice that that's someone that if you are a person who has heart disease, or that you're a caregiver, and that your loved one isn't taking their medications, then consider having their provider to evaluate them for things like depression or even cognitive decline. Right, as people get older, the more complex their medical problems are, or the more medical things that they have going on, makes them a little more sensitive to even small, subtle changes. And we can see that when folks start to decline some and they're not able to completely care for themselves in the way that they were able to before, can affect their ability to take their medications, which is why it's super cool and nice to use the pill boxes. This is why I have this picture here, just because it can be a way to remind people and help people to remember to take their medications. And again, caregivers, you all play an important role in being able to help to manage this, to help your loved ones to do this at home. Smoking, tobacco, we got to get rid of it, right? Tobacco damages the blood vessels. Tobacco damages the blood vessels, the walls of the blood vessels. And we spoke a little bit earlier about how the cholesterol plaque over time builds up in the blood vessels. And so tobacco further adds these toxins that can damage the blood vessels and can really truly increase the risk of death, heart attacks, strokes, and heart disease. And so it's super important that if this is something that if you are a smoker, or if your loved one is a smoker, that we try our best to get them to quit. And it's never too late to quit. The benefits of quitting smoking are seen regardless of how long or how much a person has previously smoked. Okay, and we can see that within a couple of years that folks who quit smoking, even after they've had a heart attack, even after they've learned that they have heart failure, that they can decrease their risk significantly over the next few years after they quit of having another attack or having another issue or progression of their symptoms. There are a number of different resources that can be used that help you quit: patches, lozenges, which are similar to cough drops, gum, and different medications. And so again, I would recommend that if this is something that you or your loved one struggles with, that you talk to your provider about additional support to help you quit. All right, limit your alcohol intake. Alcohol is not as harmless as it seems. It can, especially for folks who have heart disease, it can cause further complications. It puts an added stress on the heart. It can cause abnormal heart rhythms or arrhythmias. It can cause heart failure. It can cause issues with blood pressure. And if you already have underlying heart disease, this can worsen your symptoms. This can really worsen your symptoms. And what we see is that folks who are used to drinking quite regularly or who drink in excess, that once they quit drinking, that they actually feel a lot better when they stop drinking. All right. I will say that how do we limit our alcohol intake, right? What's drinking in moderation? And this is defined as 1 drink or less in a day if you are a woman, or 2 drinks or less in a day for men, which leads to the next question. Well, what is considered 1 drink? And this is something that I don't think many people know, because 1 drink is considered one of these 4 items here: 12 ounces of beer, 8 ounces of malt liquor, so like MD 2020s, 5 ounces of wine, and then 1.5 ounces of your spirits, so your cognacs, your whiskey, your vodka, all those different things. And so quite a bit of people that I know when I see them in clinic are drinking a lot more than what or drinking in excess of what is recommended. And this can significantly impact your overall health as well as your heart health, right? For those who have who drink in excess of alcohol every day, I will say that I would recommend that you would talk to your provider about before you just completely stop, because it can increase the risk of alcohol withdrawals and complications, which is life-threatening. And so I think it's really important that if that is something that you or your loved one is dealing with, that you partner with your healthcare provider to help you to be able to cut back safely, to help you to cut back safely. Eat a heart-healthy diet. How many times have we heard that? Right? I really like the first little picture here because it shows us that the different food groups, how we should portion our plates. And this is something that I was not familiar with until long after medical school, and had to really learn to adjust the different types of food groups on how much of the different type of food groups that I was consuming to improve my diet. But I really love the image that's next to it, the DASH eating plan. All right, DASH stands for Dietary Approach to Stop Hypertension. Some of you may have heard of it, the DASH diet. And this is great because it helps to lower blood pressure, and it helps to lower the bad cholesterol or the LDL, which we know contributes to the plaque building up and all those different things we mentioned earlier. But it really gives a good image of the things that we should be eating more of: fruits, vegetables, whole grains, fat-free or low-fat dairy products, fish, poultry, particularly without the meat so that it's healthier, beans, nuts, seeds, and vegetable oils. and really to limit everything else over here on the right side, fatty meats, full fat dairy products. So trying to avoid drinking whole milk, and instead trying for 2% or fat-free milk, all right? Decreasing the sugar sweetened beverages, sweets, as well as the salt and sodium intake, right? So a quick word on salt. The American Heart Association recommends that we take in no more than 2,300 milligrams of sodium a day. And that is the equivalent of 1 teaspoon of salt. I know back in the day when I was at my grandmother's house and she was cooking, she used more than a teaspoon of salt when she was cooking in her, and just for dinner time, just for the dinner she was making, she definitely used more than 1 teaspoon of salt. And this is how much is recommended, that we don't take more than this in one day, okay? For those who have high blood pressure or heart disease, we really should limit it to about 1,000 to 1,500 milligrams of sodium a day, which is roughly around half of a teaspoon of salt. It really requires that you really are mindful of the sodium content in the different types of foods that you're eating, checking the nutritional content on the back of the item, so that way you know just exactly how much sodium that you're getting and trying your best to limit those things. One thing that I really learned as I got older and I really tried to start wanting to improve my diet, was that there are other things that we can season our food with, that can and make it flavorful. Spices, herbs, garlic, right? These are all salt-free alternatives that you can use that can still keep your food flavorful. Regular exercise. So it's recommended that we exercise for 150 minutes weekly. But I always tell people it's just good to start somewhere, especially if you're starting from scratch, right? A good starting point is trying to do something 3 days a week or at least 30 minutes each time that you're actually exercising. And exercising can be brisk walking, jogging, dancing. I love telling people to dance because it's fun and you get a good workout in and it's healthy for you, right? Mowing the yard, those are different things that you can do to help to start somewhere and to really help to improve your overall quality of life. For those who have you've had that diagnosis of heart disease, you should not be experiencing any dizziness or chest pain or heartburn when you're exercising. And if you are experiencing those symptoms, then I would definitely talk to your provider so that you can come up with a safe exercise plan for you, okay? The plan should be well balanced and focused on total body. So endurance. So again, that's the walking, the dancing, the jogging, really focusing on the strength building, balance and flexibility, okay? And this is gonna be helpful after you've been diagnosed with a heart condition, but also as you get older as well to really keep you vibrant. I put this here because the National Institute on Aging has this phenomenal resource, not just for anybody who is more seasoned or who is aging, but for anybody who just says, I need to start somewhere and I need some help figuring out how to get started. This is an excellent resource that I went through and I reviewed, and that has been helpful for me when I've started my when I've tried to definitely incorporate more exercise into my routine, but also with encouraging and sharing this with my relatives and my loved ones to help them to get started. So definitely a resource that I think you should check out to get more information. And the last part of this section is just to spend a little time talking about these self-care action plans. And unfortunately, the video, we weren't able to finish playing it, but this is an example of a heart failure self-care action plan that a patient and their provider can create together so that you know what to do if you start to experience any signs of symptoms of heart failure. And this is something that can be a plan that can be created for most types of heart disease and most medical conditions, but just requires you to partner with your provider so that you know what to expect, what to look for, and then what your role is and what you should do to help manage some of those things. Okay. All right, we're almost done here, y'all. Almost. Let's talk a little bit about advanced care planning for those who may have advanced heart disease. If you've never heard what advanced care planning is, sorry about that. It ultimately ensures that your wishes are carried out as you desire if a medical crisis happens and you aren't able to communicate your wishes on your own. Okay. And really, truthfully, this can happen at any age and at any time and with any type of condition, but especially for those who have heart disease. I think it's really important that you start to generate some of the conversation around what that time will look like for you and for your loved ones if that were to happen to you. And the thing about this is that it really isn't anything that has to be set in stone. It's something that you can adjust as your health changes. Okay, something that you can adjust as your health changes. And really, it's just important that you start the conversation, right? And these are questions like, if your health were to drastically change, what would be most important to you at that time? Who will make decisions on your behalf? So who will be your healthcare proxy or your durable power of attorney? Which type of treatments would you be okay with having and which would you want to avoid? And to be truthful, y'all, these can be challenging and intimidating conversations to have. And oftentimes I've experienced that the conversation starts too late when someone is in the hospital, cannot speak for themselves, right? And the stress is then placed on the family members or the loved ones to try to determine what should be done to help care for their loved one. And so I would just recommend that you start the conversation sooner than later. Talk with your healthcare providers, talk with your loved ones, really create an advance directive, which is just a legal document that has your wishes in writing that only come into play once you are in a place where you are medically incapacitated, or you are not, in other words, you're not able to communicate what your desires and what your wishes are for yourself. Okay. All right, wrapping up, y'all. We almost done. Thank y'all for sticking it out with me today. All right, heart disease is common, but hopefully after this presentation, you can recognize some of the symptoms some of the common forms of heart disease, and then seek care immediately if you have those symptoms. This can be, once you have that diagnosis of heart disease or heart condition, it can really be life-changing and life-altering, but it doesn't have to control your life. You can manage this. This is manageable. All right. It does require some effort and changes on your part: eating healthy, exercising regularly, following your provider's advice, right? Quitting smoking and drinking alcohol, right? And again, this is something manageable. This is something that you should be empowered to do and take care of. And then lastly, start the conversation now about advanced care planning. It doesn't hurt. It can only help just to prepare you for that moment, if that moment were to come for you. Okay. There's a wealth of different resources available, websites available with brochures and handouts that can go into each and every one of these topics in greater detail than I had the time to go into today. And I'll send this out with you'll hopefully get a copy of this PowerPoint and can access these resources. And that's all I got for y'all. Thank y'all for allowing me to be here. And I hope this information was helpful. And I will pass it back to Dr. Ndefo.
Thank you so much. That was so good. It was so good. It was so easy to follow. It was so clear. We were engaged. We learned a lot. We were reminded of a lot. I sprinkle my salt. I don't measure it. Maybe I need to start measuring it. I just kind of eyeball it, But I think it's really important. I think even for just everybody, having the pill counter is super important so that you know when to, when you've taken, it's a good reminder for all of us, not just elderly who might be struggling with, remembering things. I absolutely really appreciate everything you shared with us. Thank you so much.
Thank you. All right, let me mute myself.
Thank you. Now, up next, we are going to, a good segue into how to use that salt and how not to use that salt is where we're going to learn right now, talking with Chef Shonah. Chef Shonah Jefferson began her culinary career at the tender age of 11, which still impresses me, by helping her dad at his local Houston restaurant. After spending many years in business and as a practicing attorney, she returned to her culinary roots by managing the family restaurant for a few years while obtaining a degree in culinary arts from San Jacinto College. She's always had an interest in giving back to others because she believes that to whom much is given, much is required. Being a Chef for Seniors owner and personal chef gives her the opportunity to do well by doing good and to combine her love for people, business, and the culinary arts. She and her team of talented chefs serve the seniors of North and Southeast Houston metro areas. Chef Shonah attended the University of Texas at Austin, where she received her bachelor's in finance and planned to honors liberal arts. She also has a law degree from Georgia State University College of Law. She has been a Chefs for Seniors franchise owner since 2018. I am going to turn it over. I'm going to stop sharing my screen so that we can see her beautiful kitchen and what she has to share with us today. All right, you are on, Chef.
All righty, thank you so much. Okay, can everybody see and hear me? I just want to make sure. Okay, great. Thanks, Pearl. Okay, so today I'm going to show you how to make another simple but flavorful recipe. It's a sriracha glazed chicken with paprika butternut squash, and you will have access to the recipe itself. I'm making a few modifications to the recipe just because when I tested it, there were some other things that I thought would blend well together as far as the squash goes. So I'm going to make a couple of slight deviations, but I'll tell you about them. So our ingredients. So for the squash, which actually I'm combining butternut squash with sweet potatoes and carrots. So the more colorful your food, the healthier it is for you. And so I like the combination of butternut squash, sweet potatoes, and carrots. So I'm mixing those together. So we've got those. I've got 2 tablespoons of oil, and then smoked paprika, a 1/4 teaspoon of pepper, and a 1/4 teaspoon of salt. And that is the only added salt we have in this recipe. So what I'm going to do is I have a bowl, large bowl here. I'm going to put my oil in the bowl along with my spices. And I'm going to mix that together. Then I'm going to add my sweet potatoes, my squash, and my carrots. Okay. Then going to make sure that everything is well mixed and that the oil and spice mixture coats all of the vegetables evenly. The other thing you want to make sure you do is you want to make sure that your vegetables all the same size, because we're going to roast these in the oven, and cutting them the same size ensures that they'll all roast at the same time. If you have large pieces and small pieces, your small pieces are going to roast faster than your large pieces, and so you'll have some soft vegetables and some crunchy vegetables, and that does not make for a pleasant eating experience. So I'm mixing all of these together. Make sure everything is nice and coated. Then I have a sheet pan here with some parchment paper on it that I've prepared. And I'm just going to pour the vegetable mixture onto the sheet pan. Using parchment paper or foil is going to make cleanup so much easier for you. So I highly recommend anytime you're going to roast anything in the oven on a sheet pan, go ahead and take out your parchment paper or coat it with foil. And then all you have to do is throw the paper or the foil away, and you have minimal cleanup of the sheet pan. So I've evenly distributed all of the vegetables there. So we're gonna put these in the oven. And you wanna make sure that you preheat your oven to 400 degrees. And while those are cooking in the oven, it's gonna take about 30 to 35 minutes for those to cook. The next thing that we're gonna do is work on preparing our chicken. So one of the things that Dr. Pitts did a great job in talking about is the use of salt. And so as far as the chicken that we're making today, the marinade actually does not have any added salt in it, which is a great thing. So what we're starting with is 2 teaspoons of maple syrup. And then I'm going to add to that 2 tablespoons of sriracha sauce. So I looked at the label for this particular brand of sriracha sauce, and actually the sodium in it is just 110 milligrams per serving. And we're spreading this out over 4 servings. So we're not talking about a lot of added sodium, but actually it's 1 teaspoon is 110 milligrams of sodium. So actually that does end up being, if we're talking 3 teaspoons, 6 teaspoons. So we're talking about 660 milligrams of sodium, but that's still spread across, in this case, we're using 6 chicken breasts. So it's not gonna be a lot of added sodium per serving, and we're not adding any additional salt. So that's a good thing. So I'm mixing that together, and then we're going to add 1/4 teaspoon of pepper. If you are sensitive to spice, you can always cut back a little on the pepper. I don't recommend cutting back so much on the sriracha because actually, since it's just a marinade, the chicken is not going to turn out to be extremely spicy. So you're okay there. And then we're going to add 1 tablespoon of balsamic vinegar. Now, vinegar is another thing that you can add to your meals that will give it a punch without adding any additional sodium. So vinegars are a great way to season your food and still keep your sodium levels low. Then the last thing I'm going to do is add another 2 tablespoons of oil. And I'm mixing this together. The recipe says just to pour it in the bag with the chicken, but I'm mixing it together just to make sure that it's nice and it's thoroughly combined. Now, the recipe calls for 4 boneless, skinless chicken breasts, about 4 ounces each, with all visible fat discarded. What I'm using today, actually, they're chicken breasts, but they're the thin cut chicken breast cutlets that you can get them in a pack, and usually it's a pack of 6 at the grocery store. I like using these because they cook more quickly than your traditional chicken breast. And then because they're thinner, they cook more quickly and they don't dry out as much. So I've got the chicken breast here, and this is in a 2-gallon bag here. And I'm gonna put this one in there along with it. Then we're gonna take our marinade and pour the marinade in the bag with the chicken. And this is a great way to any kind of meat that you have and you're putting a marinade or just seasoning it. And if you're trying to make sure you minimize any possibility or probability of cross-contamination, doing it in these plastic bags are great because once you seal the bag, you notice I have not touched the chicken at all. And then I'm able to make sure that the chicken is evenly coated with the marinade. And this is great. You can actually do this the night before you like. You want to get the maximum penetration, the marinade into the chicken and make sure it's flavorful throughout. You can marinate this the night before and put it in the refrigerator. Or at a bare minimum, set it aside for about 10 to 15 minutes. While your vegetables are cooking, this can marinate for about 10 to 15 minutes. And then we're going to take the chicken and actually saute it on the stove. So what I've actually done in the interest of time, I've actually taken a couple of chicken breasts and I've sauteed them along with the marinade on the stove. You want to make sure though, as you cook the marinade, you need it to come to a boil, because you want to make sure that you cook out all of the bacteria and potential contaminants. So I have 2 of the chicken breasts here. And what I've actually done is I've pre-plated it with the squash, carrot, and sweet potato mixture. And this recipe goes great with some fresh green beans. And so I actually made some fresh green beans along with some fresh tomatoes and onions to go along with the meal. And so here you have the sriracha glazed chicken breast with butternuts, roasted paprika, butternut squash, carrots, and sweet potatoes, and some nice healthy green beans. And so you have a nice healthy plate here. And notice Dr. Pitts was talking about the My Plate. If you look at the size, if you look at this plate, more than half of my plate is vegetables. And then you have just this small side that is the chicken breast. So it's a nice healthy plate for you. So now I will open it up to see if anyone has any questions.
Actually, I do see a question, Chef Shonah. Somebody asked if it would be possible to replace the chicken with fish or shrimp.
Sure. You just need to make sure, yeah, the marinade shouldn't be any problem for the fish or the shrimp. Actually, that's a good idea. And you just need to make sure that whatever fish that you select for this, you want to select, I wouldn't select a really, really flaky type fish. So you want to stay away from your softer white fishes and select a fish that's a little more substantial, like a cod or salmon actually would work very well with this recipe as well. And then of course, shrimp would be great.
Great, thank you.
So that's a great idea.
Thank you so much for that. It looks so good. I wish I was close so I could just take that plate.
Thank you.
Thank
You have to let me know if you try and make this one and see if it's a hit in your house as well.
Oh, I will. I was telling everyone earlier that I don't know if I said it before we got on, but the recipe that we learned in December, the salmon recipe with the roasted vegetables, I have used in my house like 3 times. It's a hit. It's really easy to make, just like this one. So I really appreciate straightforward recipes that I can make quickly, and this one really does work. So, or it looks like it's going to work. So I'm going to let you know in February how it works out. Yes, absolutely. Well, thank you all so much. Thank you very much. That is very good information. I don't think I have any questions. The recipe for this is in the chat. So if anybody wants to try it with me, you can go ahead and click on that in the chat so you can copy and paste or download it as you need to. And
I actually look forward to trying it with you. I'm just learning a little bit about the butternut squash, and I'm digging it. So I'm excited to do this with the sweet potatoes and the carrots and see how it comes out. Yeah.
Yep, so many colors on the plate, and that's always encouraging when it's natural color, right? Nothing that you had to add to make it look that way. Well, thank you so much. I am going to turn it over to, let me see, to Evelyn to close us out. Let's see here.
Real quick, Dr. Ndefo, I see this Ms. Pearl message in the chat about what recommendations for supplements. I'm going to defer that to your medical provider, because I think it's going to really depend on what your medical conditions are. And I'm just going to leave it at that. I'm gonna leave it at that. I know that's not probably an answer that you want to hear, but that's going to be the best advice I can give you without knowing what your medical history is. Okay.
Yep, I like that answer because as pharmacists, we are always faced with patients who come and tell us they're taking something over the counter that they believe is natural, but still interacts somehow with their medications. So anytime you're going to start a supplement, you definitely want to be sure to follow up with your provider before you do that, so that you don't end up using something that may have other consequences for you as an individual, even if it works well for your family or friends. All right, just make sure I'm not missing any questions before I turn it over. All right, well, thank you so much to Dr. Pitts. Thank you so much to Chef Shonah for such a wonderful event. That was so great. And Evelyn is our program coordinator for the Community Engagement Corps, and she just has some housekeeping items for you.
Hello, everyone. Thank you all so much for attending. Thank you, Dr. Pitts and Chef Shonah. That was a great presentation, and I'm for sure hungry already. Lunch is coming, and I really want to try your recipe. So I'm going to leave a survey link in the chat box for you all to fill out for us, please.
You're muted.
Oh, okay. Sorry about that, everyone. Well, again, thank you all so much for coming, Dr. Pitts, Chef Shonah. Thank you so much for your presentations. They were great. I'm for sure hungry now. Can't wait for lunchtime officially. I have included a link in the chat box for the survey. If you all could please fill it out for us. The survey pretty much gives us feedback on our presentation today, and it also lets us know what other topics you all would like to hear about. And our upcoming events. Here, let me go ahead and actually share my screen. Okay, can you all see my screen?
Yes.
Great. Okay, so I want to share a couple of upcoming events with you all. One of them being our focus group on February 12th. I'll be including a link in the chat box and a save the date for our upcoming clinical research and engagement conference on April 23rd.
Sorry, Evelyn, we can no longer see your screen. I think I did something. I didn't mean to. I'm sorry.
Okay.
I was trying to stop sharing mine, but I think I stopped sharing yours.
Let me see in slideshow. Let's see what's going on. Can you all see my screen? Okay. So I am going to include the survey link for the stroke focus group that we have coming up on February 12th. Can you all hear me?
Yes, we can.
Yes.
Okay. And also the pre-registration link for our clinical research and engagement conference coming up on April 23rd. And lastly, I would like to invite you all to follow us on social media. You all can follow us on Facebook, Twitter, Instagram, YouTube, and LinkedIn. Our handle is CEC Texas Southern EO. Thank you all so much for attending. And if you all have any questions, you are more than welcome to leave it in the chat box, and I'll also be sending you all a follow-up email after our seminar.